Hello everyone, I'm Michael Serapio. Well, Ottawa is answering British Columbia's call, announcing today that it will allow the province to scale back a pilot program that decriminalizes small amounts of heroin, cocaine, methamphetamine and fentanyl. With this approval, it means BC can once again make it illegal to use those drugs in public spaces, but that does not end the debate.
So he refuses to rule out repeating this disastrous experiment that killed 2,500 British Columbians. It's because he strongly supports decriminalization, and if he got a chance, he would do it all over again in Toronto, in Montreal, and anywhere else. Mr. Speaker, the final question, therefore, is even the radical NDP government in BC asked for him to reverse his decriminalization. Why did it take him 10 days and 66 more deaths to do it?
Here. The Right Honourable Prime Minister.
Once again, Mr. Speaker, we see the extent to which the Leader of the Opposition will make political attacks on the backs of the most vulnerable people in this country. We actually only received the completed request from British Columbia Friday last week and approved it the following Monday, 3 days later, Mr. Speaker. We will always respond quickly in a science-based way when people's lives are on the line. The Leader of the Opposition is continuing to spread falsehoods, Mr. Speaker, instead of actually following the facts and caring for Canadians.
Well, with their thoughts on the debate and Ottawa's decision, we're now joined by Talib Nur Mohammed, the Parliamentary Secretary to the Heritage Minister, Melissa Lantsman, the Deputy Conservative Leader, and Gord Johns, the NDP critic for mental health and harm reduction. Hello to all three of you.
Hi. Hello.
Mr. Nur Mohammed, I'll get you to start us off here because, you know, not only are you a Parliamentary Secretary, but you're also a Vancouver area MP. I hear the Prime Minister say that it was only last Friday that the full paperwork was submitted. But as you know, the province, your province, was asking for this scale back a week before that. So how will you explain that delayed timeline to the voters in your riding?
I think, first of all, it's important to note what exactly this is about. This is about a pilot project that the NDP government asked for several months ago. We acceded to that request. They asked for that to be amended. We've acceded to that request. And it's very important to understand that when they made the request, the specifics of the request were received on Friday. That's what we were responding to. And so now the real issue is to make sure that in this conversation we use a science-based, fact-based approach rather than misrepresenting the facts. The fact is that this program was put in place to save lives. The effort was made by the province of British Columbia. Now, there were other things that were needed to be done alongside the decisions that were made around treatment, all of those different important pillars. But the fact is that the reason for this was to make sure that the fentanyl deaths that were happening as a result of unsafe drugs in people's hands, that those were mitigated. The reality is that you can't help people who have already died. And so the objective of this program, as the BC government requested and noted, was to try and save lives. They have recognized that there are challenges. They came to us with this request. That request has been met.
Ms. Lantsman, what do you say to that? Because, you know, I hear your party hit the federal government on this one hard, but at the end of the day, this is a program that BC, as a provincial government, wanted to try out with the intent of saving lives.
This is an ideological crusade by this government to legalize smoking crack, smoking meth, shooting up in playgrounds, in public places. It is responsible for the death of 2,500 British Columbians last year, 40,000 since this government came into place. This will go down as one of the most insane policies that the government enthusiastically supported and then waited 11 days with some weird explanation about when paperwork was done to turn back. Even the radical NDP in BC decided that this was too radical for them, and the Prime Minister today could not disavow decriminalization. So we want to know what he believes and what he's going to do next and where.
Mr. Johns, what's your take of it? Because you have the two sides right there beside you. On the one hand, arguing that this is for an effort to save lives. The other saying that it just doesn't make sense if you want to save lives.
Well, first of all, my heart goes out to all the victims and the families of the loved ones that have died to this tragic crisis. And as we know, in a health crisis, incrementalism costs lives, and the Liberals have taken a slow approach in terms of responding to this health emergency. They still haven't declared a national public health emergency. The Conservatives' disinformation also costs lives. I mean, it's completely false that decriminalization is the cause of the toxic drug crisis or the reason people are dying. We've heard from police that they wanted some tools to be able to deal with public drug use, but they also said that criminalizing people causes more harm and they don't want to go back to it. We can look to Alberta, where they don't have decriminalization, where they don't have a safer supply. Now, you know, as of today, when we saw the release of the BC Coroner's report, that Alberta now has the highest death rate per capita in the country. In fact, Lethbridge is triple that of British Columbia, and they don't have decriminalization. They don't have safer supply. The things that the Conservatives like to cite when they point to the reason people are dying. They're dying from poison drugs manufactured by organized crime. That is according to the police, to health officials, and this disinformation is harmful. It creates more stigma. And it creates a lot of hurt to the families of the loved ones, when in fact we need to come together, we need to declare a public health emergency and have a robust debate how we move forward together as a nation in the middle of this health crisis.
I think it's important to note, Michael, that when this policy was requested by the government of British Columbia, it was in partnership with the City of Vancouver, local police, local law enforcement who came forward and said, we support this. So when our government looked at that request, we made the evidence-based, science-based decision. And as Gord rightly pointed out, if you look at the magnitude, the quantum of deaths in a place like Alberta and the Conservative government, the far-right Conservative government in Alberta, and Saskatchewan, the lives that are being lost there without any openness to looking at ways to save lives, that speaks volumes for what a Poilievre government would do, which is frankly to put at risk more and more and more Canadians and play politics with people's lives. We're not going to do that. I think it's really important for Canadians to understand the rationale for doing this, the rationale for pulling it back, and the urgent need to look at treatment of addictions, to look at safe supply, to look at all of the elements and tools available in our arsenal to make the right decisions in a four-pillars approach to saving lives.
Michael, why don't you let me tell you what a Pierre Poilievre government do? We will ban hard drugs. We will ban smoking crack in a hospital room. We will ban shooting up in a playground next to schools. And we will ensure that those who are affected by addiction get the treatment that they need. We have two parties here arguing still that decriminalization is the way forward, that these kinds of insane programs are the way forward. And we want to make sure that
Melissa, it's hard to support healthcare when you keep cutting funding for it. You keep voting against it.
They both tell us that they won't do this elsewhere, that they wouldn't do this in Toronto, that they wouldn't do this in Montreal. We have the right to know, and Canadians have the right to know, whether they believe in decriminalization or not. We hear that Gord absolutely does, and we haven't heard the Liberals disavow legalization and their failed experiment, which has killed thousands of people and diverted drugs. It kills thousands every year, and it kills 6 people a day. It took them 11 days to tell Canadians that this was not a plan that they were going to go forward, and they still can't say that it's not something that they're going to go forward with in Toronto, in Montreal, in Halifax, and anywhere else that asks.
But Ms. Lantsman, and this is picking up on what we heard from Mr. Johns there, if the Vancouver Police are in favor of trying a pilot program, if the city, the provinces, why not allow them to try to save lives best they can by trying something different rather than just the status quo?
The pilot program has failed. Even the radical NDP BC government, who has been for this, has come crawling for to ask the Liberals to go back on this failed experiment. We want to know if the federal government is in favor of decriminalization. It's clear that the answer is yes, because it's not no, and we want to know that if they're going to expand this program to places like Toronto and Montreal. Canadians have a right to know that.
Mr. Nur Mohammed, how would you answer that question? Is the government prepared to expand this program and try other pilots?
Well, Ms. Lantsman is entitled to her opinions, but not to her own facts. What are the facts? The facts are the province of British Columbia, alongside the City of Vancouver and the VPD and other law enforcement, came forward and said, we would like to try this. We reviewed the application. We accepted their request. They came back and said, look, this isn't working in the form that it's in right now. We said, That's what you want. We will accede to that request, and we will grant the request that you've got. Those are the facts. We are a science-based, evidence-based government. When provincial governments come to us, regardless of their political stripe, with things that they would like to try to save lives, we are going to assess those and evaluate them on their merits. Ms. Lantsman can make up whatever narrative she would like. That's up to her. But the facts are the facts, and what we have done and what we will continue to do is to do everything that we can in our power to save lives. That's
a
our
really
So you are
long
open.
answer to say yes.
You are open. Well, you are open then as a government to try this pilot elsewhere.
What we have said, and what we will continue to say, is if there are means that are brought forward that are evidence-based, with the backing of the relevant authorities, with the backing of the relevant data, that show that we can save lives in this urgent moment in our history where people are dying from toxic drugs, we should be open to looking at what the science says, not making ideological decisions.
I hear the word urgency, and again, back to urgency. What we're not seeing from this federal government is treating this as a health emergency. They've spent less than 1% of resources that they applied to COVID-19, yet we've lost more lives in my home province of British Columbia. The province of BC is looking for a federal partner. We can look at what the Conservatives will do when we look to Alberta and Saskatchewan, where it's a disaster. The death rates from toxic drugs are skyrocketing. Their single-focus policies are a complete failure. And we look at even north to Alaska, their death rates grew 45%, a Republican state, last year. And that isn't a state that has safe supply or harm reduction or decriminalization. So we've got to get away from this fallacy that British Columbia's decriminalization policy or safe supply is responsible for what's happening. What we need is to scale up rapidly treatment on demand, prevention, recovery, education, and we need to stop criminalizing people for using substances, something we've heard loud and clear from both the police and from health professionals, and we need to listen to them. We know the Conservatives don't believe in evidence, and they don't believe in listening to the experts.
But Mr. Johns, how do you respond then to the point that was being made by Ms. Lantsman here, that British Columbia itself is pointing to a failure and as a result is scaling back? Does that not point to underlying problems with this program overall?
I think with a trial, you have to listen to the public and you have to be willing to adjust. They heard loud and clear from the police that they needed to make sure that they had tools to move people along. But they said only in extraordinary circumstances would they arrest people. They also unequivocally clear they do not believe criminalizing people who use substances will help. They said those days are gone. Quote right from the president of the BC Chiefs of Police. We need to listen to them. And what we're doing is encouraging the provincial government, the federal government to do just that. But Alberta and Saskatchewan, they don't want to listen to anybody. Their single focus is costing lives. Look at Lethbridge. They closed safe consumption sites, and now their death rates are triple that of British Columbia. What we need is the federal government to get on board, open more safe consumption sites. That's a call to action by the Chiefs of Police, by the way, to make sure that people don't die when they're using substances and they use them safely. And we've only had one death in over a decade of safe consumption sites. So we know that they're important, but they're also an important tool so that people aren't using in public, especially people that are marginalized or homeless.
And Ms. Lantsman, is there a danger here that your party is leaning in too much on criminal law and not focusing enough on a health issue?
Look, I think that it's very clear, and Canadians have been very clear, British Columbians have been very clear. It's exactly the reason why the BC government asked this government to stop their insane project. People are dying. There are needles in soccer fields being picked up by parents before their kids play. There is meth being smoked and blown in the face of nurses in hospitals, which does not happen in Thornhill. It happened in BC because you gave them a carve-out to allow that to happen. I'm sitting between two politicians that want to see more taxpayer drugs, which we know have been diverted. We know that the Vancouver police, the 50% of what they've seized from safe supply or unsafe supply, as we would call it, are from the hands of diverted drugs that end up in schools with young people.
Said pharmaceuticals is nominal in what they're getting on the street.
And I think that both of these MPs who want to see decriminalization go forward are going to pay for it when they have to explain that to their constituents who clearly want to see something else.
The police have been unequivocally clear that the diversion of safer supply is not what's killing people. It is toxic fentanyl. They've repeated that over and over again, that pharmaceuticals is nominal at best and hydromorphone is just a fraction of that, never mind diversion of that.
To sit here and say that diversion is okay in the schools and with young people who are now getting
Nobody
addicted
wants to see diversion.
drugs,
but
I
the
think that
police
is
are
a
saying
warped
that is
view.
well,
this
that
is
is not
exactly
fact.
this is exactly
the Conservatives fail to listen to the experts. Even the Law and Order Party will refuse to listen to the police themselves.
I go back to. For those of you that are watching this show, I would encourage you to read what Ben Perrin, who was a senior advisor to Stephen Harper, had to say. Ben is one of the strongest advocates for taking the approach that says, first of all, don't criminalize addiction. Don't treat people who have a health crisis, who have a health challenge, as criminals. He has been out there advocating for an intelligent, thoughtful approach. Now, what we did is we looked at BC's approach, BC's request. We agreed to that request. They came back and said there are challenges. We want this to be changed. We accepted their request. What we have to be asking ourselves as a country is, are we prepared to do things to save people's lives? Are we prepared to look at science?
Let me jump in. I'm sorry to interrupt, but quickly running out of time.
Yeah.
We have less than a minute here, so I want to go down the line here, beginning with you, Mr. Nur Mohammed. What do you want Canadians to do right now? Exercise patience, be more critical. At this point in the debate, what do you want Canadians to do in reaction to this?
I think it's very simple. I think Canadians need to look at the facts. The facts are that BC made a request. We acceded to that request. They came back. They said the pilot program that they had designed didn't work as well as they would have liked. They wanted us to pull back from that. They wanted our permission to pull back. We've granted that. But what I would like Canadians to be able to do is to think about all of the tools available in our arsenal to deal with the opioid crisis, to think about the question of how we address tainted drugs, all of the challenges that we are seeing. And that's why we've put money forward to support law enforcement in this effort. That's why we've put money forward into the healthcare system. And we're going to keep working with provinces who, by the way, are the jurisdiction responsible for these challenges, to work with them to ensure that we are saving lives across the way. Regardless of political party, we have to be looking at the important work of saving lives and ensuring public safety at the same time.
And Ms. Lantsman, same question to you.
Well, we are going to advocate for no taxpayer-funded drugs that end up in the hands of those who abuse them, and we want to make sure that those who are afflicted by addiction get the treatment that they need and not more taxpayer-funded drugs. We want to hear from the Liberals an unequivocal denunciation of the failed decriminalization policy, of the failed legalization of smoking crack and meth in hospital rooms and finding needles because people are shooting up in parks next to kids. It's very simple. Are you against it? And if you're not against it, when are you going to approve it for Toronto, for Montreal, for Halifax, and for anyone that asks? They should be able to. It's a simple yes or no question. And what we didn't hear on the panel today is that.
Okay. And Mr. Johns, final word to you.
It's a health issue, and they need to declare a national public health emergency. They need to rapidly work with the provinces and territories and scale up treatment on demand, prevention, education, recovery, and scaling up safer supply of substances and stop criminalizing people. Also, they need to reinstate the expert task force to give the government expert advice, oversight, and accountability. And lastly, have a First Minister's meeting. We had an auto theft summit, but we haven't had a summit on one of the most deadly health crises in the history of our country. It's actually unbelievable. Not saying that auto theft isn't an important issue, but this is clearly a much more important issue to all Canadians.
Okay, well, that is the time that we have. Talib Nur Mohammed, Melissa Lantsman, Gord Johns, thank you very much for the time.
Thank you.
Thanks.